Hello, good morning. For those who have joined just a few seconds ago, we are still waiting for a few more participants, so we will start in 1 or 2 minutes. I mean, it's not as many people in there as registered, but probably that is a normal thing, and I'm not sure whether the other people will join. What do you think?
Yeah, we can start. So thank you everyone for joining today's webinar. And well, today Sonja will start introducing what's the project itself, and then we will do a short overview about the action plan and present also how you can contribute. We will end this session with a Mentimeter and a discussion. And just to let you know, some housekeeping rules is please use the Q&A box to submit your questions so we can answer them. And remember that the chat is available so you can discuss, but remember to just put the Q&A, the questions on the Q&A, and you can follow us on LinkedIn and on Twitter that we have an account for the project. So we can start, Sonja.
Yeah, I will start with a brief overview of what the project Procure4Health is. That presentation was supposed to be done by the project coordinator, who unfortunately cannot be with us. So I take over, and I guess you will be a bit bored of me after this webinar because I'm the only presenter today. Anyway, so Procure4Health is a project funded by the Horizon Europe program by the European Commission. And what we are a community of health and social care innovation procurers that was launched by actually only 19 procurers, but representing most of the countries in the EU, and some supporting organizations that help the procurers in doing the things we promised to do. Next slide. By now, because we are a community that is open to procurers outside of the project, we are 105 procurers from 25 countries in Europe, and we want to build, and actually I think have already built, a strong community of procurers in the area of health and social care, bringing them together to share experiences in innovation procurement in the area of health and care, doing twinning activities, joining forces to tell the supply side that there is a demand for innovative solutions and things like that. So we present most of the countries in the EU, and we are of course still open for new members to join the communities. We have so far 105 procurers in the community, as I said, 115 supporting organizations. So these are organizations like, for example, research organizations that are not directly procuring innovations, but are still working in the field and are important players to support the overall innovation procurement process. And we also have the supply side represented in the community, represented currently by 98 suppliers. Next slide, please, Anais. Yeah, let me start a bit to explain what innovation procurement is, or what we understand or have defined it in our community. So generally, innovation procurement is more than just acquiring new technologies. So we interpret it as a strategic approach to leverage public purchasing power to drive progress and to create new solutions that address either societal challenges or challenges that public organizations, public health and care providers face. It can take several forms that you can see listed here. One is that it is buying research and development services to deploy innovative solutions, which enables the creation of innovative solutions tailored to the unique needs of care providers, for example. This approach is pretty early in the stage of innovation procurement and helps to tackle complex challenges and therefore stimulates also economic growth. It can also be about buying innovative solutions that are not yet available on the market, so that procurers together go to the market to say, we need a solution that addresses a certain need, but we cannot find it on the market. So that is a bit of a facilitator towards the market. And it can also be about buying solutions that are available, but not at a certain scale. Here, public buyers usually act as early adopters, and therefore accelerating the deployment of innovative solutions and encourage a wider market uptake. Next slide, please. Yeah, there are several benefits of innovation procurers for different stakeholders. First of all, obviously the public buyers, so public institutions often or daily face increasing societal demands that they have to meet, and the demands for their citizens. The complexity of addressing these challenges and demands requires new and modern solutions and also processes that are aligned with these solutions. And innovation procurement can, of course, contribute to that. By investing in innovation, public buyers have the opportunity to increase the positive impact of public spending, obviously, and therefore modernize the public sector, which is necessary because we of course all face restraints in resources and things like that. Also, the suppliers benefit, so the supply side, supplying innovation to the public market, for example, is a big branch because public procurement represents approximately 14% of the GDP in the EU. So this purchasing power is quite big and should be leveraged to encourage innovative solutions. There's also the opportunity to co-create the solution with public organizations in a risk-sharing scheme, therefore having the opportunity to, by working together, to better address existing demands and existing requirements. And also that, of course, increases their customer references and potentially their market success. And in the end, what are we doing this for is, of course, the citizens across Europe who will benefit ideally, obviously, in the end, by improved public services and more inclusive and accessible services for everyone. Next slide, Anais, please. Yeah, the direct objectives and scope of the project we are building a community, bringing procurers together, and we try to support them in getting better, getting trained on innovation procurement. There are several things we do. We do capacity building by different things, like we have a resource catalog where people can find interesting and important resources about innovation procurement in health and care. We have a twinning mechanism where we bring together procurers who are quite experienced in innovation procurement with procurers who are not so experienced, and bring them together to learn from each other. We have a networking and matchmaking facility in the community. And of course, we want to create a policy impact by collecting things that are going well, but things that are not going so well, by developing policy recommendations in order to bring these to the policymakers to improve things in the future. So this is in a nutshell what we do. Next slide, Anais. And I would want to pause here for a first Mentimeter question to get a bit of a better idea what your challenges are in implementing innovation procurement. So I give you a bit of time to go to menti.com and enter the code that you can see here, or use the QR code that brings you to the first question. And please only answer the first question for now. And Anais, I would like to share my screen now to show the results. Live, hopefully, yeah. Yeah, so we are interested in the biggest barriers your organization faces in implementing innovation procurement. You can tick 3 of the 4. Okay, a few things coming up. Lack of funding is the obvious thing, and the thing that is very important and in most cases an issue. Expertise or training, lack of expertise and training. Yeah, that's something all our procurers, I think, a challenge that many of our procurers face. I still wait a bit because we don't have answers from all participants, and I really encourage you to use the chance to share your challenges. Yeah, regulatory challenges is also something we often hear. Whereas I personally think there are regulatory challenges, but I think the most challenging thing is that there is unclarity or a lack of understanding that the regulatory challenges are actually not that big when you do, for example, a PCP, but the lack of reassurance procurers need that they are regulatory safe, I think, is kind of missing often. Okay, I wait 30 seconds longer and then we can continue. Thanks to the ones who have already responded. Okay, Anais, I think we can continue. Do I need to stop? Yeah, I guess so. Yeah, maybe I pause here to give the participants, because we are not so many, the chance to ask a question in case there is a question so far, either on what I presented so far on the project or the Mentimeter results or anything like that. No, it doesn't seem to be the case. So then I continue. Maybe next slide, please, Anais. Yeah, as I said, we really encourage the procurers to share knowledge and help them to build capacity for innovation procurement processes. As I mentioned, we have I mean, many things for that, but the two main mechanisms are the capacity building catalog and the twinnings. The capacity building catalog is a repository of resources, including market research results, case studies of innovation procurement, and best practices in the area of health and care that procurers can access if they are registered to the Procure4Health community. We have implemented a twinning scheme that I think explained earlier, but if you want to know more about it, I'm happy to explain a bit more. And we also provide tailored training and mentoring in the community or to the procurers who are a member of the community. Yeah, next slide, nice. What we have also implemented very early in the project is 6 working groups to promote strategic topics, where we encourage procurers, but also sometimes suppliers are part of these working groups to discuss, network, and learn from each other. These topics have been jointly defined by the procurers at the beginning of the project, so these are not like topics we have invented out of the blue, but these were topics procurers suggested as topics that are relevant and important for them to apply innovation procurement to. The 6 working groups are digital healthcare and ICT, integrated care, sustainability in procurement of innovation, personalized medicine, impactful innovation, and value-based procurement of innovation. Yes, and we have worked in these working groups from the beginning of the project. They are open to procurers outside of the project, and many procurers have already joined these working groups to help us shape our activities and make them aligned to their needs also, so that what we do does not only relate to the procurers of the project, but also to the outside world. Next slide. Yeah, now I come to the core of the webinar today. So what we have done as one activity of the project is to develop an action plan that serves as a kind of guidance for procurers addressing recent challenges in health and care, derived from our different topics of the different working groups. Next slide, please. We have developed a framework of this action plan. So the vision and mission of the action plan is, in the end, of course, to improve health and care through innovation procurement. So innovation procurement can contribute its share to improving health and care services. We have 4 action areas, as I said, and we have defined a challenge for each of these action areas. For sustainability, it is that services and solutions in health and care need to become more sustainable in terms of environmental, societal, and economic sustainability. In digital healthcare, to better use the opportunities digital solutions provide to improve health and care services. For integrated care, it is to provide more integrated and effective health and care services and tackle all the challenges related to integration that probably most of you know. And for precision and predictive medicine, which is quite a challenging area, I have to say, to address and create affordable personalized treatment. We have also defined 2 strategic pillars that we think are relevant for all of the action areas, all of the 4 action areas I just mentioned. One is value-based procurement, and the other one is to make sure that innovation or innovation procurement leads to innovations that are actually deployed in the market. So it doesn't make too much sense, of course, to work on innovations that in the end fail to reach the market and therefore access bigger population groups or public services. So these are kind of the 6 areas where we have defined a specific action for. So we have 6 actions defined in the action plan. We are defining, and I cannot explain the whole action plan here. We have defined requirements for the different action areas. These are requirements, for example, in relation to technical requirements, managerial requirements, business and financial requirements, but also requirements in terms of legal and regulatory issues. We also define needs of the procurers, barriers they face, tools they can use, and techniques. And each of the chapters also defines a good practice example where procurers can go to see how others have tackled challenges in that area. And then we also, for each action, we have defined a series of steps procurers could or should take in order to tackle the action that is tackle the action that we have defined. As I said, I cannot by any chance present the whole action plan. In order to really make it useful for you, I'm afraid you have to read the whole document because it is a complex topic. It is a complex area that cannot be presented in 20 minutes. But yeah, to give you an idea, of course, I try to summarize what is in there. The objectives of the action plan is to help procurers to prepare the implementation of innovation procurement related to tackle the challenges I just presented. And we have defined 6 key actions for public buyers according to the 6 action areas we have defined. For value-based procurement, the key action meaning the procurers in Procure4Health have defined is to introduce a value-based approach to procurement of health technologies and innovations. And I will have a slide on each of them, so no worries. Impactful innovation to incentivize the adoption of innovation and cultivate an impact-first mindset among all involved in the innovation procurement process and implementation process. Sustainability to implement a strategy and policy for sustainable procurement in health and care organizations, which some organizations have, but others don't, and the action plan is meant to support them in implementing such a strategy. Digital healthcare to establish a mechanism to procure innovative digital solutions for health and care, meeting stakeholder needs. For integrated care, it is to design and implement shared innovation procurement approaches for integrated care service delivery improvements. And for precision and predictive medicine, it is to develop and deploy strategies to promote the integration of innovative products and services in predictive and precision medicine into clinical practice, which is often quite a challenging process. I have a slide on each of them. If you go to the next slide, Anais. Yeah, the 2 strategic pillars, as I said, for innovation procurements are value-based procurement and impactful innovation. Or maybe I refine, there are not those 2, there might be others, but these are the 2 topics our procurers, so the procurers in Procure4Health, considered as the 2 that are most relevant for all other action areas. Value-based procurement, just in a nutshell, focuses on facilitating purchasing decisions that optimize the outcomes and reduce the total cost of care, rather than just minimizing the price to purchase a product. It therefore encourages risk sharing amongst the buyers and the suppliers, and in the ideal case, leads to optimal care delivery, because you look at the outcomes for the patients and the end users, as a final outcome. and not only at the price and the purchase at the lowest price ever possible. It therefore incentivizes innovations that meet patient needs more properly and defunds those who provide little value in the end. So you can imagine that you may purchase a very cheap solution that in the end doesn't provide much value or less value than another solution that is more expensive in the beginning, but throughout the whole journey provides more value to the patient in the end. Value-based procurement also, in the end, facilitates faster access to innovations because the financial risks are being shared between the supplier and the buyer, and also gathers, and that is important in order to do value-based procurement, gathers robust efficacy data. Impactful innovation, I think I mentioned that before, aims to help procurers to maximize the likelihood that successfully piloted innovations are deployed in the end to the market, and therefore are in the position to achieve a possible impact at all. Many solutions die at the stage of a pilot, and that would be okay if the pilot ends with the result that this solution is not a good solution to be deployed. But there are also many successful piloted innovations with good results of the pilot that still do not enter the market. And that's something, of course, that should be avoided. There are, as for all of the action areas, multiple and complex barriers that hinder the adoption of innovation. And to address these barriers is, of course, a critical step in order to have, in the end, a true impact on the society. Yeah, next slide. I think I said all of this. Yeah, to give you an idea of what the different actions in the action plan are about, I have created one slide per action area that hopefully helps you a bit to understand the general notion of what is in the action plan. So as I said, for the action area sustainability, the action our procurers have defined is to implement a strategy and policy for sustainable procurement in health and care organizations to meet ecological, societal, and economic needs without compromising future generations. Yeah, which is the nutshell of what sustainability is about. The challenges that yeah we all face, and of course also the health and care organizations in relation to our environmental factors are addressing waste, emissions, and resource use. In relation to societal issues, it is using innovation procurement to promote decent work, equity, and also ethical practices. And economically, it means balancing costs while maintaining sustainability goals that are more and more important. So our procurers, and we think that innovation procurement can be used as a strategic opportunity for sustainability, or to boost sustainability, as it is, yeah, as I said, health procurement is accounting for a significant share of public spending, and therefore if we manage to implement those sustainability factors into innovation procurement, we have a good chance to drive systemic change towards a more sustainable health and care provision. Next slide. Sorry, it went too smoothly. I didn't even realize. The action area digital healthcare, it is a topic, of course, that is not a new topic, but still a challenging topic for many procurers and providers of health and care services. The action our procurers have defined is to establish a mechanism to procure innovative digital solutions for health and care, meeting stakeholder needs. What do we mean by meeting stakeholder needs? To meet the needs of all stakeholders involved. So not only the patients that will use the solutions in the end, but also the professionals who often use the technologies, decision makers, maybe also family carers. So really depends, of course, on the solution and the kind of the solution, but to really address the needs of all stakeholders concerned. So we would like to leverage innovation procurement to improve health and care service delivery by using digital technologies. Challenges that persist are, and that is, I think, personally quite interesting because I'm working in the field for quite long, and interoperability is a challenge that was always there and still is. So addressing interoperability with existing systems prevailing at the organizations who provide health and care, whether that is a hospital or a caring organization, a nursing care home, doesn't matter too much. They all use technology so far, and to integrate a new solution into these existing systems is technology-wise still challenging, let alone if you talk about addressing all the processes that need to be rearranged around the new technology when you integrate. So this is a challenge our procurers defined as being still prevalent when they do innovation. Also, the topic of managing data security, privacy, and regulatory compliance is and will always be a challenge, because there will always be new regulatory issues because technologies are developing. For example, now all the discussions around AI, the new AI Act, of course, is something that is new, and people need to get acquainted with that. And overcoming resistance to change. None of you has mentioned that in my previous Mentimeter survey, which is quite interesting, but that is something our procurers mentioned as a challenge, overcoming resistance to change among staff and organizations. There are, of course, opportunities associated with it. Digital innovations and solutions can help streamline workflows and reduce errors, enhance patient outcomes and service efficiency, and also address needs that are yet not met. Next slide, please. Integrated care. Interesting area. I think still many challenges prevail here as well. Our procurers have defined the action, design and implement shared innovation procurement approaches for integrated care service delivery improvements. It is, you could argue it could also be part of the digital healthcare action area, but we have deliberately decided that it is a separate action area, because the challenges for integrated care when it comes to innovation procurement are often even bigger and more complex, because more organizations, more stakeholders, and in the end, more potential buyers are involved when it comes to integrated care provision. So there are certain areas, topics that are specific to integrated care or that are more complex to integrated care. The challenges are probably not so different from digital healthcare, but it is still a more complex area because more stakeholders are involved. In some organizations, for example, when you deploy a new solution, may gain from the solution, and when someone else pays for the solution, then you run into certain problems when it comes to deployment. The challenges our procurers have mentioned is that fragmented healthcare systems lead to inefficiencies and therefore poor patient outcomes. still, as for the previous action area, the issue of interoperability between existing and also new health IT systems, and a limited coordination across departments and sectors. The impact of the fragmentation, I think, is clear. It leads to increased costs, for example, because services are provided more often than it is necessary by one provider and then another one again. Patients are being asked to tell their story multiple times, which does not help them to be satisfied with the services provided and things like that. Next slide, please, Anais. I'm not sure whether I would say the most challenging, but for sure the newest area and the most complex, I think, area is predictive and precision medicine. Our procurers have defined the action to develop and deploy strategies to promote the integration of innovative products and services in predictive and precision medicine into clinical practice. What they see is different opportunities, improved diagnosis and treatment precision, and to provide more patient-centered and holistic care in improving the outcomes for patients. But of course, and probably all of you know that there are certain challenges associated with predictive and precision medicine. For example, it is a high-cost service with a potential for overdiagnosis and treatment, which then again is associated with higher costs and no improved value for the patients. It is complex because services, data, and care processes need to be aligned properly and also personalized for each patient. There are still regulatory and financial hurdles at system levels. And another topic again here is reservations and resistance from healthcare professionals. Next slide, please, Anais. The key objectives our procurers have defined are to identify innovative technologies to enable predictive and precision medicine, to align governmental, legal, and financial frameworks with the needs of predictive and precision medicine. And I think most importantly, as one of the first steps, is to develop expertise to manage high-tech predictive and precision medicine projects effectively. We have also defined a vision for 2030, which is to have a unified methodology for identifying predictive and precision medicine-ready diseases and technologies accessible across Europe. In the end, enabling individualized treatments and population-based preventive care. Thank you, Anais. I pause here again to give attendees the chance to ask questions, because it is quite a lot I had to present, and maybe also to give Marcin, who has joined, the chance to add anything he would like to add.
Hi guys, I'm still traveling, so just give me like 5-10 minutes. I'll join you and make some comments. Okay?
Yeah, sure. You don't have to. I was just to give you the chance.
Thank you.
Okay, and the others still don't have questions. It's either far too much or super clear. Anything between this, I think, is possible. Yeah, what would we like from you, and what do we think, how do we think you can benefit from reading the action plan and also giving some feedback? So a few slides from me still. Sorry that it is only me. What we think is important is to really invite you to help shaping innovation procurement in the area of health and care, and to make the action plan applicable not only to the procurers in our project who have developed it, but also to procurers and as many procurers as possible outside of the project, and maybe even outside of our community, which is of course bigger than the project itself. So what you will gain, I mean, what we will gain is clear. What you will gain is to access a framework addressing common challenges. And I think the challenges we have defined are rather generic and rather prominent. So I guess most of you are facing similar challenges. I at least would be surprised if that's not the case. So the action plan provides, or at least tries to provide, a structured, ready-to-use framework that you can apply, which will then save you time and effort in tackling these issues from scratch. It is generic, and that is by intention, so you can use the action plan to apply and adapt it to your own situation prevailing at your organization. And that has to be the case because every healthcare system is different, every organization is different, but it is a good starting point, I think, if you want to tackle these challenges. If you contribute to the action plan, I think it also signals commitment to innovation and commitment to the different action areas, for example, sustainability we have defined. You can also still influence what we are doing. So when you provide us feedback on the action plan, you help us making it better aligned with your and others' real-world procurement challenges. So the more diverse feedback we get from different organizations, different countries, the better the action plan will be in the end in helping you addressing different challenges through innovation procurement. Yeah, and therefore also tailor recommendations to diverse healthcare settings. I think I said that before. Yeah, and of course, in the end, it helps you and us to contribute to a system-wide impact. So the more input we have, the bigger the impact potentially can be. Next slide, please, Anais. Before I go to this, maybe we present the next slide, and then we do the Mentimeter survey in the end to also open the discussion if there is any. So there are several things you can do to contribute. One is, and Anais has also put the link to the action plan in the chat. Download the action plan and provide feedback. We have a feedback form available on the same page with questions that we invite you to answer to give feedback to the action plan. We would need that feedback by the 4th of April in order to develop the next version of the action plan. So it's an iterative document, and we will work on the next version of the action plan from 4th April onwards. You can also, of course, get in touch with me or the, I think, general Procure4Health email to get bilateral support. For example, in case you would like to locally adapt the action plan to your context. This is something our Procure4Health procurers do and have to do because we have promised to do that. So we have certain tools, templates available for that. In case you would like to do that as well, we invite you to get in touch, and we are happy to provide support for that. The next version of the action plan will be available on the 22nd of April, and you're all invited to endorse it. What does endorsement mean? It's a public statement of support of what is written in the action plan. And we will also, correct me if I'm wrong, give you some visibility if you endorse the action plan. So think about it. It's not yet, we are not yet there, but this is something where you can get involved. Before we go to the Mentimeter, because I would like to use the Mentimeter to enhance the discussions a bit, but also to get a bit of your feedback on what I presented. I'm sure that none of you was able to read the action plan prior to that webinar, and that's fine. So I've tried to align the questions in the Mentimeter survey with what I presented only. But before we do that, maybe I pause again in case there are questions. And I think nice people can also only raise their hand, and then we can open the microphone,
Yes,
right?
if you prefer to have a short discussion instead of writing the question, we can open your mic. There's no problem.
I think that this is easier, and we are not so many people. Also feel free to raise your hand, and then Anais can open the microphone. Okay. Then back to the Mentimeter. And I think people have already, okay, I will share my screen because people have already started to answer the other questions in the Mentimeter. How do I do that? Yeah. So the participants who have not yet answered the follow-up questions, feel free to do so now. So one of the next question was how well, and I need to move this a bit. Oh, I cannot see it. No. How well do key action areas align with your organization priorities? And we ask you to rank each area on a scale from 1 to 5. And I see sustainability, that's not a big surprise, I guess, is ranked pretty high. Value-based procurement, I guess that's either it's ranked the lowest, probably it's also not so easy to understand, I guess, within a short presentation. Yeah, but generally it seems that we have ranked, or that we have chosen the action areas quite well. In the feedback form, if you really use the feedback form to provide more comprehensive feedback, we also, of course, give you the chance to suggest an area yourself, which is not included in the action plan as of now, and not only rank the ones we have defined. All right, I go to the next one. Can I do this? Yeah, so the next question was, to what extent is the shift to value-based procurement relevant for your organization procurement practices? Seems to be relevant, rather relevant at least, but there are, of course, not many people who have responded it. I wait maybe for another 1 or 2 minutes in case someone still wants to respond to the Mentimeter. Okay, seems to be rather relevant, although the action area per se was ranked lowest in terms of importance. Okay, this was an open question. What are the most significant barriers you encounter in adopting and scaling innovations after they have been successfully piloted? Lack of expert in the field, motivation and funding, digital expertise, so again, expertise, integration challenges, standardization, okay, relates a bit to interoperability. Yeah, funding after PCP, yeah, that's a big barrier, I think, too. Again, expertise, capacity, and integration challenges. Yeah, most of the people are pretty aligned with their answers. Anyone there who wants to elaborate a bit on what you said? I know it's not so easy to raise your hand in a webinar, but yeah, if you want to do so, feel free to do. Okay. Yeah, and then there are no responses as of yet. Maybe I was too quick, so I again pause here. There was another question: what sustainability challenges do you face in procurement? So I pause a bit to give you the chance to read, digest, and write a response. Maybe people would benefit from an example. A sustainability challenge could be, for example, water waste for a nursing home when you, I don't know, shower patients. That could be a sustainability challenge, and how to address that or improve that, things like that. If you don't have any sustainability challenges you can think of, you could also write that so that we know that you have read the question. Okay. I guess I will not longer torture you and close the Mentimeter presentation. I think it is still open. If you think of something, yeah, put it in there or write us an email, anything like that. We are open for it. Okay, I think that was it from my side. I don't know whether Anais, you would like to add something, or Marcin, or whether anyone has a comment or a question, criticism, whatever. We are happy to discuss.
Well, thank you so much, everyone, to join today's webinar, and you will have a follow-up email where we will send you the link so you can watch it again, the recording, or download the slides. And you will also find the link we sent on the chat to be able to download and read the action plan. And your feedback is more than welcome. And I believe Marcin is not there, so if you think so, Sonja, we can close the
I'm
webinar?
here.
Oh.
Sorry, I'm here. If possible, just a minute. What I would like to say is that I would encourage you not to treat the action plan as a holy book. Use it. Be egoistic. Just make the best use of what is there. Adapt it to your local situation. So don't. If you do something differently, do not worry that somebody is going to come in and tell you to do something wrong. No, do what you feel like is the best option in your situation. And that will be my only comment. Thank you.
Thank you so much. And I think we can close for now the webinar. And if you have any questions, yes, let us know.
Yeah, thank you everyone for your time. Thank you, Anais, for organizing it.
Bye.
Bye.